we on? Good morning. Management Forum, welcome to December. I hope you've all had happy and safe Thanksgiving holidays. We're going to cover a lot of ground today. We're going to talk about COVID. We're going to talk about kind of what the status is, where we are, talk about a bit about vaccines. We're going to talk about what we have to continue to do here in the hospital on staff to keep ourselves safe and to keep our families safe. And we're going to talk about capital projects. I'm sure you've seen a lot of the activity, especially around the UCSF Research and Academic Building. So Terry Saltz will be here to talk about that a bit later, and then we'll have open questions with Susan. So let me do a couple of things here, a couple of little bits of business, and then we'll get right to it. Okay, 1 second, please. Okay, so we've just gone over our agenda. This will be recorded and can be viewed later at the same link. We'll take questions. Actually, send in your questions on chat whenever you have them, and we will get to as many questions as possible. And, you know, there may be some delay and in getting to your question, but not to worry. We see them all, and we will get to them. So with that, let's get right to it. We have Lisa Winston here with us, who's going to be discussing COVID. And again, send your questions in when you have them, and we will get to them as soon as we possibly can. Lisa, come on up.
Hi, good morning, everyone. I hope everyone is doing well this Tuesday morning. Just starting off our COVID update for you here. As everyone is very well aware, we are now into our third surge here in the Bay Area, which is you know, very similar to what is going on in other places in the U.S. as well, and some international areas too. So as we talked about last time, you know, the concerns were that as COVID cases have surged across the country, and now there are particularly high cases in the South, growing cases in the Northeast, and a continuing very difficult outbreak in the Midwest that is slightly better than it was before. Not surprisingly, the Bay Area and San Francisco are also seeing an increase in cases. I think probably everyone there, area counties, including San Francisco and the city of Berkeley, have put into effect more stringent measures getting us in a similar situation to where we were in the spring, although certain things like retail are more open than they were before. But with the recognition that eating and drinking with others is a major risk factor for spread of COVID, outdoor dining has now closed in San Francisco and those other Bay Area counties. The surge plan at the hospital remains about the same. So we're continuing to care for our floor patients, mostly on the 6th floor. Our ICU patients on the 4th floor, and then pediatric and OB patients on their units. And the hospital does have a plan for how we would expand if our cases continue to go up. There is a good chance that cases will continue to go up as they have other places. But the hope is that as community actions start to decrease the number of cases and decrease the amount of transmission, that will also have a positive impact on the hospitals. And that's, of course, the major reason for the more stringent measures that are in effect, is to protect the acute care hospitals from being overwhelmed with very sick patients. So that begs the question, in addition to following the community guidelines, as we all should be, what can we be doing here at the hospital? And I think probably people are aware that as cases have risen in the community, since this is a very widespread disease, we have also seen more cases in healthcare workers, which are, this is what we've seen all along, generally linked to what is going on in our communities. So just as a reminder, in the hospital, we need to wear our masks. I think everybody's pretty good at that. But we need to not take off our masks and to eat and drink when we're near others. We know this is really, really hard. The holiday season is all about food and festivities and sharing and being together. And but this year, the best gift that we can give each other is to stay a little bit apart so that we all stay healthy. So just as a reminder, the eating and drinking is a big deal. And, our usual reminders about hand hygiene are, also relevant for COVID and for everything else that we don't want to spread in the hospital. So, a few more questions. I wanted to turn and talk a little bit about vaccines, because I think that these are very much on people's minds right now. And as you're probably aware, the FDA is reviewing the Pfizer-BioNTech vaccine this week, and they actually put out their review of the data today. So emergency use authorization could come as early as a few days for that vaccine. And the Moderna vaccine, the second vaccine that has a similar mRNA technology as the Pfizer vaccine, is going to be reviewed next week. I'm not going to go into a lot of data on the specifics of the vaccine, because I heard from our CMO, Luke John Day, this morning that we'll be having a town hall on Friday specifically to go over the details of vaccines. So please stay tuned for that. But if you all are NPR fans, you may have heard the really lovely story this morning about the UK beginning their vaccination program for COVID. So they vaccinated their first two elderly folks. They vaccinated a 90-year-old woman named Margaret. She was the first one to receive the vaccine. And then very fittingly, the second person to receive the vaccine was a man named William Shakespeare, an 81-year-old man with medical comorbidities, which led the media in the UK to begin talking about the taming of the flu for people who enjoy puns. So certainly not just the U.S. is thinking about vaccine strategies. This is, a key issue everywhere. And of course, this is a global disease, so we should celebrate and applaud all that's going on worldwide to control the virus, because we live in a global world, and things that happen elsewhere in the world will affect us too. I did want to just say a couple of words about vaccine side effects, and we'll talk about this in more detail on Friday. So many people have, all of our vaccines have some side effects. So for example, almost everyone who's listening will have familiarity with the flu vaccine, and know that it's not uncommon to get a sore arm after that vaccine that usually goes away quickly. These vaccines, these mRNA, do seem to have some side effects, which sometimes people refer to as reactogenicity. And they probably have a little more reactogenicity than some of our vaccines. And actually, the vaccine that it looks most similar to me in terms of the profile of the side effects is one that you may be familiar with, the Shingrix vaccine or the shingles vaccine that has been extremely popular over the last few years because it does such a good job in preventing people from getting shingles. But it does have some side effects like fatigue, myalgias or muscle pain, and sometimes fevers. So that is something that we are going to have a really good plan to manage. Because some of those side effects do overlap with other things like symptoms of COVID. So we will make sure that as we start to roll out the vaccines, that we have a robust plan in case people have side effects. The side effects are predictable. They usually occur for a short period of time, and they occur relatively soon after receiving the vaccine. So we think that this will be very manageable. I am frequently asked by people, well, am I going to get the vaccine? How do I feel about getting the vaccine? And I will just tell you, I am extremely excited about getting my vaccine dose. And so I will be first in line when it is my turn. And the hospital is developing a plan in conjunction with the health network for rolling out the doses of vaccine that we will receive, because we will receive a relatively small amount at the beginning, but with a commitment that we will continually be updating the supplies so that we will be able to vaccinate everyone who's on campus, and that is the goal. Another question that people have asked, because some people are a little more nervous about the vaccine, is, will the vaccine be mandatory? Is it required to get the vaccine? And our hope is that because this vaccine is so effective and because COVID is so dangerous, that most people will share my enthusiasm and be eager to get the vaccine. But we do not think that it is going to be mandatory or required at the beginning. So if there are people who are more nervous and want to wait a little bit longer, that should be feasible. As with many things that have an important component of public health, guidance is likely to be updated as we move forward, as it is for things like the flu vaccine. So as the vaccine becomes more widely available and we get further out into what we very much hope will be pandemic control, that's something that could change over time. But when people are notified that they're eligible to receive the vaccine at the beginning, we think that people will be lining up voluntarily, but we won't be requiring you to get in line if you're feeling a little hesitant to start. And why don't I stop there, and happy to try to take any questions.
Okay, that's great. Thanks for covering all that. One question from one of our audience members. Are we ready to open the low acuity care center, LAC? Are we thinking of we'll have to open it for this surge, that kind of thing?
Yeah. Very briefly, and then Susan, I think, can give more details about it. So a lot of thought and effort went into developing the LAC, the low acuity center, and it truly will be ready if we need it, but the hope is that we will not need it because there are actually a lot of other things in place that we can go to before that, not just here at San Francisco General, but across the city in terms of utilizing the spaces that, we're already providing medical care. So if needed, that will be an option. But I think the hope is with the early projections we have now, we're keeping our fingers crossed that we won't need to go there. Susan, do you want to say something?
Good morning, everybody. So first I want to just say how incredibly lucky are we to have such an expert and incredible medical advisor as Dr. Lisa Winston. So I really want to appreciate her for all that she's given to all of us during this exceptionally unusual time. We've used her skills and abilities to their greatest extent, I think. So speaking to the LAC, everything that Lisa said is correct. We are working very, very closely with both the chief medical officers as well as the chief executive officers for all the hospitals in San Francisco. We are also looking very carefully at the data. We have extremely robust projections that I think are as good as they can be for really tracking, where the pandemic is going. The LAC is ready to go. It is essentially a warehouse that has been, very carefully and thoughtfully renovated to take lower acuity patients for a short period of time at the very end of an acute care hospitalization. We would much rather care for patients in the hospital if we can before we send folks to the LAC site. And as a result, we would really only ever open the LAC if all of the baseline and surge capacity in the city, meaning not just here at ZSFG, but everywhere in all the hospitals in the city, was exhausted. So we're quite a ways from that still, although we're very concerned about capacity, obviously, with the case rate going up the way it is right now. I'll just take this opportunity to say this is why we have a shelter-in-place order right now. We really want to interrupt transmission and change the reproductive rate from what's estimated to be about 1.45 right now and get it down below 1. So we'll be much better served by taking care of patients in the hospital rather than in the LAC site. If we need the LAC site, when all capacity in the city is exhausted or near exhausted, that's when we would open the LAC site.
Before you go, Susan, can I ask you another?
Yes, you may, Brett.
Thank you. I know that you meet regularly with the CEOs of the other hospitals in the city. What can you say about the citywide capacity for hospital beds at this moment relative to the surge of COVID cases?
Right. So thankfully, we can all look at the citywide hospital capacity on the city's website, COVID website, every single day. We have about a third or so, I didn't look at those numbers this morning, but about a third of our ICU capacity, about a third of our med surge capacity available in city hospitals overall. Cases are going up, hospitalizations are going up rapidly, so we expect that to change. Projections are showing that if nothing changes, we could run out of our ICU capacity at the end of this month, and we could run out of our med surge capacity in early January. And so that's why, again, we have a shelter-in-place order to change and interrupt what's going on with virus transmission right now in the community. So we have capacity now. We might run out of it, towards the end of this month and into early January, but we're hoping that won't be the case because of the orders we have in place.
Thank you. Thank you very much.
Great. Sure.
Okay. Yeah. Okay, and then we'll go to Terry, and then we'll open it up to broad questions. Does that work for you?
Great.
Okay, thank you. Okay, super. All right, we're going to get back to more questions about COVID in just a bit. Right now, I'd like to shift gears in a big way and bring up Terry Saltz to talk about where we are with capital projects on campus. Terry.
Thank you, Brent. Good morning, everybody. I'm Terry Saltz, and this is Capitol Corner. I want to start by saying generally we are seeing delays in construction due to some supply chain, labor resources, and project support resource availability. And that's showing up across the board in all our projects. COVID-related work that's going on, I don't know if anybody has noticed, but there's a big blue structure that's been delivered to the A lot, and that's going to be our new patient ATS, and we hope to have that up and running before Christmas. So you can look forward to an enclosure. Instead of a tent, we're going to have an enclosure that's going to have heat and cooling, running water. It'll be fun for all. So we're going to have that before Christmas. So Merry Christmas. There are rehabilitation relocation project. The timeline for that is slipping into 2021. Our contractor is developing a recovery schedule. Let me adjust this camera. The problem with this project is that it impacts the start dates for both our dialysis location and our public health lab project. So we're eager to complete this project. Transition planning is occurring, and a larger transition team will be meeting to plan for this relocation. Transition will include facility fit-up, equipment installation, licensing, staff training, and workflow planning. Our 6H surge space has also slipped in time. Work right now is pending certain state approvals. Once obtained, we plan to complete this work in January. This, of course, will support our ability to pursue the seismic retrofit of the building. Seismic retrofit of the building will commence early 2021. One of the first efforts will relocate phlebotomy and registration from the OPD lobby to the main lobby. You may have already noticed some changes with the furniture and layouts. Once started, this project will continue for up to 2 years and will impact most areas of operation in the building. As planning firms, areas of impact will be engaged in unit-specific planning. The UCSF Research Building, that one's hard to miss on the south end of our campus. Site work continues on the underground utilities, roadway, ramp, and foundations. December 17th, they're going to be doing some, on south turnaround right now, there's a detour in the pathway for the fire hydrant tie-in. That will be worked on December 17th, and after which the walkway will be restored and the driveway will be returned to 2 lanes. On the 21st, they will start a gas line tie-in work, which will impact traffic on 23rd Street, on the upper portion of 23rd Street, San Bruno, or right at San Bruno. That work will be on the 21st, and that will last about 6 weeks. They will maintain 1 lane of traffic in both directions during that work. December 28th, there will be additional fire hydrant work, which will have impact the 23rd Street sidewalk for about 4 weeks. And then January 2021, they plan on doing some water and electrical tie-ins, and that will have impact on the Vermont Street configuration. They will maintain 1 lane of traffic at all times during this work. The noisy work will continue throughout December with the normal activities of trucks, concrete work, hammers, and saws. Dust is continuously monitored and with real-time information being transmitted to the project managers. And then the mitigation measures include water, misting, and street sweeping. As far as the UCSF work, minimal work is going to be expected on December 24th and the 31st. And the construction site will be closed during Christmas of the 25th, as well as for New Year's on January 1st. I do want to mention the campus restriction work that's happening in building 3049, where we're going to be locking down that corridor, is started with electrical and data work, and we believe we're going to have the card readers and intercoms installed the week of December 14th. Depending on the parts availability. And I'd be remiss if I did not mention that there is parking still available at the San Bruno lot. That completes my report. Thank you.
Okay, let me ask you a question, Terry. So
Sure.
You mentioned
delays due to, I guess, shipping delays, is it, or supply?
Well,
chain?
I think that everybody's experiencing right now when you order something, there's a longer delay in getting parts, and that's having a ripple effect throughout the industry. So what timelines as far as materials are just getting longer, harder to find, getting more creative on how to transport items. So that's just had a general ripple effect throughout the entire industry.
Okay. You mentioned the ATS alternative testing site in the A lot and the upgrades you're going to do there. Are there going to be upgrades to the facilities in the A lot, or are we in pretty good shape there?
So right now we have several different activities that are happening in the plaza there. We have the patient ATS, we have the OHS ATS for employees, and there's also a chart study that's happening there. So with the new structure, the idea is to move the patient ATS over to the new structure, and that will give us the ability to flex up or flex down. So that will give us an extra tent to be used for another activity, or we can take it down depending on the need, take it down and reduce the footprint in the parking lot.
One more question, and that is, could you talk about noise impacts right here in Building 5 of the work that's being done?
So it's hard to do construction without any noise at all. So there are going to be noise impacts. We try to minimize the higher levels by doing it in off hours. Fortunately, most occupancies in the building have hours of operation that we can work around. But there are some occupancies that have 24-hour care. We have to be very careful about. That's one of the reasons. One of our projects is to relocate the SNF during the seismic work, to relocate from 4A to 7A, so we could do the work on 4A without disturbing the patient. So there is noise. Right now we have activity on the 3rd floor and 2nd floor and 6th floor. And so at times we do have noise, but we try to transmit to the local adjacent occupancies when that noise is anticipated. So far it's been controllable. I do want to say that once the seismic work begins, there will be a lot more noise in the areas of work. There'll be saw cutting, chipping, concrete work, and again, we will work around schedules where we can, but it's bound to be an inconvenience at times that we'll just have to get through.
And you've taken steps to mitigate the noise when possible, right, and the dust as well.
We use local shielding when possible. We use misting and water controls. We use containment barriers. So there's many mitigation tools that we use to control noise and dust.
Thank you. I think that's all the questions for you at this moment.
Thank you.
So actually, let's do this if we could. Lisa, could we get you back here, and then Susan, in just a second, let's go back to, okay, super. So Lisa, just a couple of follow-up questions. You mentioned the town hall on Friday.
Mm-hmm.
Do you know what topics will be covered?
My understanding is that it will be about COVID vaccines.
Okay. Could you reiterate the staff behaviors that we would be looking for, the ways that our staff can keep themselves safe and keep their families safe?
Sure. I know we start to sound like a broken record. And these are actually the same behaviors for work as for home. But wearing masks whenever you are with someone that is not one of your family members in your household, including all the time when we are at work. The data that have been coming out about masks is really very compelling, that masks are extremely protective. And so, we should be wearing them as we are and keeping them on. And that's really one of the reasons why eating and drinking is so much of a challenge, because although our infection control program manager, Elaine Decker, has amazing advice about moving your mask a little bit and putting the food in your mouth and chewing with your mask on. And that works, but it's a little hard to accomplish with every meal. It just means that we have to be extremely conscious of our behavior when we're eating and drinking, and that we just can't be within 6 feet of each other, that we want to try to have barriers. And so that means we can do things like use the alternative break site. If it's a nice day, we can eat outside. And then I think the thing that's hard is, we want to eat with our colleagues. We want to take a break and relax and, eat with them. But actually, that isn't the thing that we should be doing. We should be staggering so that we are doing our eating and drinking when others are not doing their eating and drinking, so that we don't have to have multiple people who aren't wearing masks. And, there's light at the end of the tunnel. We won't have to do this forever. But it really is what we need to be doing right now.
Okay, thank you so much.
Absolutely.
So, great. So, why don't you come up?
Good morning again, everyone. I thought I would share a few points just to underscore what Lisa is saying. And to give these points, these are the 5 key takeaways from the shelter-in-place order as expressed by our health officer, Dr. Tomas Aragon. And I will say that I don't know if all of you have heard, but Dr. Aragon was just appointed yesterday as the state public health director, and he will take on that role in January. He is just an incredible person, and this is a great recognition of his skills and talents. And I'm personally going to really miss him here in San Francisco, but I feel so grateful that we have such a strong and talented state health director. We really, of course, need a strong health director at this time. So I just wanted to share these because I found them really useful. And these 5 points are really about the behaviors that we need to be doing at home, as well as, primarily at home, but they also apply here at the hospital. So the first one is to stay home, except for going out for essential services and obviously coming to work. Don't gather with persons outside your household. This is the primary rationale for closing dining, playgrounds, etc., and interrupting transmission of the disease. Number 3, don't travel. This is a very strong recommendation. We had this recommendation coming from the state, the federal government, local government. It's a really important thing right now. Number 4 is to avoid crowds, especially indoors, but also outdoors. You want to stay away from people. And then finally, number 5 is to follow guidelines, meaning face covering, physical distancing, ventilation, hand washing, disinfection, all of that. So I found these 5 key points really helpful as we think about what our lives are like during these next 3 weeks at a minimum of the shelter-in-place order. The other thing I wanted to take this opportunity to do is to thank you all. I can't really express how much gratitude I have for all of you, especially at this time, after all this time. This pandemic has been a huge burden on all of us in the world, really. But no group has been affected, I think, more than healthcare workers, because you guys are at the front of you're at the front face of the pandemic, and it's really meaningful, especially that we here are taking care of people in the community who need our care the most. And those folks have been burdened, possibly even more than healthcare workers have been. And I'm just really grateful to all of you for your compassion, your intelligence, your creativity, and your resilience, especially at this time. So I just really wanted to thank you for all that you're doing here at ZSFG.
So we heard from Lisa about her excitement about the vaccine. How do you feel about the vaccine?
I could not be more excited. This time is a very interesting time in the pandemic because on the one hand, we are seeing the biggest surge that we've seen since the beginning of the pandemic. That's honestly, that's scary, and it's very concerning. On the other hand, we have a lot of experience dealing with surges right now. We know exactly what to do. We know exactly how to prepare. We know what to do in the hospital to take care of the surge. And we have vaccine, and it's coming right now. I mean, my best guess is that we're going to start to vaccinate people within the next couple of weeks. And so that could not be more exciting. Now, of course, it's going to take time to vaccinate all of us and the world, really. But having that light kind of shining towards the end of the tunnel, it couldn't be more exciting. And when it's my turn, it won't be my turn right away, that's for sure. But I'm ready to get the vaccine.
How many, like the latest experience we have with widespread vaccine in our staff is the flu vaccine, right?
Mm-hmm.
That we get every year. Of our staff, how many get the flu vaccine in a given year?
Well, this year we had incredible success with the flu vaccine, and that is really incredibly important because it is working to ensure that we don't have a big burden of influenza on top of a COVID pandemic. So Lisa probably knows it was well above 90% of staff who received the flu vaccine this year. That is not only a very high percentage, but it's also the earliest that people have been vaccinated. And we did that intentionally. We had a big push to vaccinate people before the 1st of November. And you all just really doubled down to participate with us and get vaccinated. And that's been a really great thing. So thank you.
You have colleagues around the country. Could you talk about the kind of relative response to the virus and this disease, kind of San Francisco versus other places in California, other metropolitan areas in the country?
Yeah. Thanks for that question. So I'm in regular contact with CEOs around of hospitals around the country. And that contact makes me even more grateful to be in San Francisco because as our mayor and our health director and our health officer always remind us, what we do here in San Francisco is based on science, data, and facts. And we know that because of the way the community has responded, because of the way our leaders have led through this pandemic, that we have had many fewer hospitalizations. We've had tens of thousands of fewer deaths. So we have really done the best that we possibly could here in our local community to manage the virus. And so that's all that impact of fewer illnesses, fewer cases, fewer deaths, that really impacts us here in hospitals. And so we've been spared relatively to our colleagues, not only our colleagues in California, but our colleagues all around the country, because our leaders have had the courage to really take on the pandemic head on, and in a way that's based on science, data, and facts.
At some point, we're going to be past this. Knock wood.
We will be past this.
What will we take from this experience? What are we going to learn from COVID, and what might be different in a lasting way after this is over?
Yeah, that's a great question. So I think most of you know that I write a note every Monday morning, and I'm writing a note in my head right now for the year-end note. And that note is going to be about all the good things that have happened as a result of this pandemic. I know that seems a little odd to be writing about good things in a pandemic, but the truth is that there are a lot of things that we've been able to do in a positive way that as a result of the pandemic. We've been able to hire nurses a lot faster than we ever were able to before. We have been able to really reorganize our front line of care so we can see patients in the emergency department, urgent care, and the clinics in a more effective way than we ever have before. We have telehealth now, and that has been a lifeline for access for all of our patients. We've been able to use our spaces in the hospital more flexibly than we ever have before. I would also say that we have such a tighter relationship now within the San Francisco Health Network, with the department, and with our city. And seeing the way the city has supported its residents, its health workers, ZSFG in particular, has been really gratifying for me to see. So that's just a small list of the things that have been good, be lasting as a result of that. I mean, certainly, telehealth is something that I hope will be lasting beyond the pandemic. But there are many of these positive things that I think we can take away as well.
So this is our last management forum of 2020. What would you say, kind of in closing, as we sort of close out the year for our time together as a management forum?
Wow, that's a big ask, Brent. Well, 2020 is a year unlike any other. It's easily, I would say, the most challenging for sure, but also the most rewarding year of my career. There are so many things that have been, really tough for our community, for our residents, for our families, for us as individuals personally. And, I just want to recognize how challenging this year is. It's really, honestly, it's hard to put it into words. But again, one of those very positive things, seeing how this community rises to a challenge. And this community, meaning the ZSFG community, has risen to many, many challenges of all types, pandemics, plane crashes, community crises of all types. And this year, though just devastatingly difficult in so many ways, has really been reaffirming in terms of what this community here at ZSFG is capable of. So in a very way, we try that, and I hope that everyone can see the silver lining this year, as much as it's been, the hardest year on record. I guess that's what I would say, Brent.
Wonderful. Thank you.
All right.
All right.
Yeah, thank you all. I'll see you out there. And thank you for helping keep all of us safe.
Great. Thank you. We'll see you all in January.
All right. I just